Hey guys, I'm IfyDika. Welcome back to my channel, and if this is your first time here, a very big welcome to you. Do subscribe right now and hit the bell button so you get notified when I post new videos. Today I'll be talking with Farida. We're going to talk about cancer stigmatization. This video was actually done a while back, so you might hear some things that would show that it's from the past, the recent past anyway. Also, Sharon, a psychologist, is going to come give us her own professional point of view about cancer stigmatization. So just sit back and relax and enjoy the video. This is my friend Farida. She's my colleague. She's a gastroenterologist. What else should I be adding? There are a lot of titles to her name. But okay, you know what, Farida? Introduce yourself. Maybe you do a better job because I can go on and on and on and I won't stop.
No, let's just make it brief. Hi guys, I'm Farida. I'm a gastroenterologist, research to be specific, and I am the founder of Rahks Foundation. So Rahks Foundation is just a medical foundation I put together to help people cope with cancer and other advanced terminal illnesses. That's all.
Okay, that's great, and that's actually one of the reasons why I invited her to come talk, because I feel like you have, enough information to give us, and I don't really know a lot about cancer. I've heard so much about it, but I wouldn't say I've come as close as researching into it or meeting people who actually have cancer and all that, and hearing about it. And it's quite strange that today we are shooting the video. That's the day that we had this sad news, and
I know how we
to die of cancer.
Can you imagine how long we've been postponing this
video?
And just today, we decided Saturday 3 o'clock today, and it just had happened that Chadwick Boseman died today of cancer. Like, that's really sad. That's very sad.
Sad man. And a lot of us have heard about cancer and stuff, but different people have different ideas. There are myths about cancer, and people see it in different kinds of ways. So, and I feel like this brings about stigma. That's why I said, okay, let's talk about cancer stigma. What it entails and what's it's involved, what goes around it, to understand. So when people say, when people hear about cancer, I feel like what what comes to their mind at first is cancer is a death sentence. Once you have cancer, that's it. I really don't think it's so. Babe, what do you think about this thing?
No, I feel like it is. I feel like it is something that a lot of people have to understand. That people have to know that ideology is wrong. They need to understand that when someone has cancer, it doesn't necessarily mean that person is going to die. It doesn't mean that's the end of that person's life. Do you understand? Because most times when you have cancer, it's not even having the cancer that kills you. It's the idea that, oh wow, I have cancer, so that's it. Do you understand? That is what kills most people. It leads to depression and all of that. So when you hear someone has, or if you go into a hospital, you're ill, you don't know what's wrong with you, you've done every test, and it keeps coming back, everything is fine. And then finally the doctor says, oh, I'm really sorry, it's cancer.
Oh gosh.
The first thing that comes into your head is, oh, wow, are you serious?
So this is it.
Cancer. See, if that's the first thing that's coming into your head, I expect the other person, that's like any other person you meet, who you tell, oh, I have cancer. I expect the first thing for them to do is, oh, don't worry about it. Don't stress about it. Just be positive, It's something that you would definitely overcome. Don't sit there and look at them and be like, that's the end, though. Don't be angry. There's the truth after it. No. I've talked to a lot of people that have cancer. I've interviewed certain people that have cancer, and their answers varies with, in terms of what was your response when you first heard you had cancer? A lot of people will tell you, oh, I cried. A lot of people will tell you, oh my God, I thought that was the end of my life. I lost my friends. But some people will tell you, oh, you know what? It was a relief for me in a way, because at least I know what's wrong with me, and you know, I know that, okay, this and this has to be done for me to be cancer free. Do you understand? But when people come out and, you know, they're not being supportive, support network is one very important thing cancer patients need.
Very true.
So when you come out and people are not being supportive and not encouraging you, how exactly do they expect you, the cancer patient, to feel?
It's painful, I think. And when you mentioned friends, it made me remember a situation whereby your friends would no longer want to hang out with you, and then it could be of two reasons. I feel like one could be that some have this idea they have this idea that maybe they could catch the cancer, and then others have this idea that okay, since he or she is always sick or something like that, let's not disturb the person, let the person just, you know, so they isolate the person that has the cancer, and they don't know how this affects the individual actually going through the cancer. You see, since you've spoken to people that have cancer, how do you think they related to friends not hanging out with them, or friends or people who think they can catch cancer when they come close to them? How do they relate with that isolation?
The last person I spoke to about this exact same thing said when her understanding, or the way she was able to play it out in her head was, okay, maybe they don't know, you know, maybe they don't get it, or they don't know what to say
There's
to me.
There's not enough
Do you
awareness.
Understand? Exactly. So she was being very positive, you know, with the fact that, you know, it might not be their fault. They don't know what this thing is. They don't know why all of a sudden I look this way. I've lost weight. I don't have hair on my head. My eyebrows are gone. Do you understand? So she made, I believe she made herself believe that, you know what, they didn't do it from a negative point of view. You know, they didn't do it from a malicious point of view. It was just what they knew, what they understood, and that was how they expressed it. Which, in my own opinion, no. That is wrong. That is totally wrong. That is absolutely, that's a no. For my friend, I tell you I have cancer.
And then the first thing you want to do is you're like, give space.
So I feel like if, regardless, we're all human beings, right? And this thing can happen to anybody, just anybody.
Yeah.
So if someone comes to you with this heartbreaking news, you know what, I feel like the first thing for you to think as a human being is, what can I do to make this person feel at ease with the situation?
Yeah.
What can I do to make you feel better? You know, not to think about it too much. Don't feel depressed. Don't suffer from any kind of anxiety. Don't be afraid of anything. I'll be here with you all the way.
Yeah.
Do you understand? So I believe for me to tell my friend I have cancer and you walk out or tell me, oh, I didn't know what to say, or I didn't know what to do, you were never my friend.
I feel like even if you don't know what to do or say at that instance, a hug will do. A hug goes a long way.
Get your phone, text, hi, how are you doing?
Check on the person once in a while at least.
If you feel like, okay, seeing the person is too much trauma for you, you know, your friend who
very
used to be like really chubby, or, you know, fit, exactly, very vibrant, very active, you walk into the house and you're seeing the person just almost anorexic, no hair at all, no eyebrows. I know, like, most people, you know, people take things differently. So most people might not really have the, what's it called? The strength.
I was about to say mind
like that.
or liver.
might not really have the strength, but you know what? It won't hurt you to just text the person. You know, just find out how you doing. Just one word of kindness. You don't know how far it could go. Don't tell me I didn't know what to say. Excuse me.
Some people don't talk about cancer. When they talk about cancer, they talk about it in a hushed tone, you know, don't say it too loud. And then especially if it's now a specific kind of cancer, like cervical cancer now. Now, normally, that part of the human is a place that people don't talk about. Your vagina, your cervix. People don't like, nah, why will you talk about your cervix? Talk about your vagina. Don't do that. But when you're outside and saying things like you're talking medical stuff about vagina, and people just look at you like, hello, like hello. But now, when people have cervical cancer or they want to check
cancer,
some don't really know how to go about it because they are uncomfortable with, you know, coming to check if they have this disease or all because of what the society has put in you. I don't know if you're shy or I don't know what to call it. Is it shyness or is it because especially if it's a male doctor that is going to do the smear for you, the pap smear.
You know, we're very well. You know, we're
culturally and religiously driven in this country.
Driven, exactly. So usually people feel very, and that is I feel like that's one of the reasons why the rate at which women die of cervical cancer,
because they don't check it.
High. Now, speaking as a northerner, let me break it down for you in that, because you might not really get to see that. But do you understand what I mean? If you go to the north now, right, you walk into a lady, maybe a lady and a husband walks into a hospital, and you know the sign that this woman, you know, might have, you know, she's been having very strange bleed. She has been bleeding like profusely, you know, very strange feeling, you know, with her woman, everything. She walks into the hospital with her husband. In the north, the man will stand there and tell you, as a male doctor, you're not touching her.
So it has to be a female.
If it is not a woman that would, if it is not a woman that would touch my wife, I'm taking her home. There's so many cases.
Yeah.
So many cases. If it is not a lady
then
that's going
if
to
maybe
her wife,
at that time there is no woman around, there will be no treatment.
That is it. There will be no treatment. It will have to take a lot of intervention from people. You know what, this thing is either life or death. You have to let her do it. If not, she might end up dying. So you can imagine, this is 2020 and this is the world we live in. This is why I talk to a lot of medical professionals, not just like around like where we stay and everything. I talk to people also based in the north, and I talk to them about setting up outreaches like this to talk to women, educate women on these things. If you're not talking to them, most of them are not educated in the first place. So the way an educated person would understand the effects of, you know, cervical cancer and the importance of doing a pap smear is not the same way an uneducated person will take it. So most times it's so difficult. You have no idea. You have to go there, and if you don't speak the language, I'm really sorry for you. You have to go there and talk to them, educate them, make them understand that, you know what, you have to do this. You must let your wife do this. So sometimes I try to talk about these things, but there's a lot of hostility. Oh yeah.
And then you're not just a Lagos person. You've been educated. So they were like, UK person self.
Do you get? So They'll be like, you're too westernized. Just Farida, just keep quiet. Just hold your Western education in one place and leave us with. And they don't know that they're killing themselves. Nah, it's
Well, I feel like, see, it looks like a lot of things. It looks like a lot, but then if we start little by little, creating awareness little by little, you tell your neighbor will tell this person, the person will tell. Before we know, we'll reach where we want. But if we want to look at the big picture and be like, to talk to these people is going to be really, 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 it's going to be a handful. So awareness, we have to start this awareness thing, creating awareness little by little. Wow. Well, I feel like if we want to keep talking about cancer, it's something that would take days, weeks.
We're going to spend the whole
Okay,
day.
so it's the reason I had to choose this little specific parts to talk about stigma and
Stigma, yeah.
how we relate to people that have cancer. Cancer is not a death sentence. It can be treated. You can fight it.
Now, cancer patients face a whole lot of stigma from people due to the fact that there is this general idea that no one ever gets cured from cancer, and the idea that cancer always leads to death and all and all. And then there's this general perceived notion of the signs and symptoms of cancer. When you see people who don't have hair anymore, you just automatically assume it's as a result of chemo, not knowing that there's something called alopecia, where people just have bald head. And these people face a whole lot of stigma because somehow they're looked at as a walking time machine. They could drop dead anytime. They're not gonna live that long. There's so much pain, so let's just excuse them. And this could lead to discrimination on a whole lot of levels. They could be exempted from a whole lot of things. You won't give them jobs because you feel they could drop dead anytime, or I don't even know if this job is going to inconvenience them and all of that. And that's really not true. They all want to be treated like normal human beings. They want to be treated like everyone. Yeah, they are going through something, but they also need money. So when they're excluded from economic activities, it means they will have less money. And this would invariably affect the kind of treatment they could get. And then there's also that stigma of, once you know the kind of cancer a person has, take for example lung cancer, there's just this automatic assumption, this person used to drink before or used to smoke before, so we look at that person with less pity and more of disdain. And the truth is that it's not everyone who has lung cancer that had it as a result of smoking. Several things. Some people look at them as some people begin to socially withdraw. You used to invite them for various programs, occasions, social gatherings, and you're like, she's sick or he's sick, let's not inconvenience them, let's just allow them be. Gradually you are pushing them towards isolation, towards aloneness, and towards exclusion. And these things are not healthy for recovery or for the general treatment of any illness. Beyond the fact that a person is taking medications and getting better and seeing physicians and going for treatment and all of that, there is that part of social support from friends, support from family, social interaction. A person could be taking drugs for an illness and not have the adequate social support, and that could be very, 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 very evident in the person's treatment. Treatment could be slower. And once the mind is not involved in treatment, there's a whole lot less the body can do. There is that mind-body relationship. Now, if you're treating the body, the mind also has to be fine. You cannot treat the mind to the exclusion of the body or treat the body to the exclusion of the mind. So it's very important to bear in mind that these folks are facing a whole lot of pain. That trauma, that stress of having to change life. The life you live when you don't have an illness you're managing is different from the life you live when you have an illness you're managing. They are going through that stress already. And in the fact that you see them with the eye of pity, you exclude them, you just segregate them, exempt them from things, look at them with that eye of, it's a past sin that caught up with them and all of that, has a way it weighs them down, leads to depression, and could lead to several other things. So it's important that when we have people who are managing cancer around us. One, you need to be around them all the time, inquire about their health, how are they doing, how do they need you to step in and all of that. You don't just push away that, we don't know how we could be inconveniencing this person. You're pushing them away, is sending a message. You are more or less giving them social death before the actual physical death. So it's very important to check on them and ensure they're fine. Whatever way you can help, whatever way you can come in, it's very, very important. Be with them, call them. Don't let things change because they are ill. They need a whole lot of support and a whole lot of interaction. So let's make that decisive decision today to reduce stigma. Stigma is not nice on them. It's not nice for them. It doesn't help their treatment process. You know, that helping hand, that support that we have around. And we should quit that notion that everyone who has bowed head is obviously going through chemo, or anyone who has lung cancer, this person used to smoke, or this person is suffering from having used birth control pills, that's why she's having cervical cancer or whatever form of cancer. And just that preconceived notion that this causes this, that is why this person is this, is wrong. So we need to be there for them. One, we need to ensure that when they need jobs, we provide it for them. A person gets cancer and you automatically fire the person or disengage the person from work. It doesn't help. Once a person's mental health is not fine, it will be evident in the physical health. So if this person is trying to battle cancer, and there are people who have gotten cured from chemo, the cancer have reduced until it vanished and it couldn't be found anymore. So cancer definitely does go. It doesn't necessarily have to lead to death, especially if it is found early. So today, let's make that decisive decision not to stigmatize, not to separate, not to push them or exclude them, but include them and give the support that we can. Thank you very much.
It pays a lot to read and research on things. Let's not, treat people in an inhumane manner rather. Let's read more, research more. Let's get more knowledge about cancer so that we know how to treat people and relate with people with cancer. It really help. It really help a lot. So Farida, thank you so much. Seriously,
thank you for having me.
I'm really happy that we're able to make this call. Seriously, thank you so much, guys, for watching. Thanks to Farida and Sharon. That was very, very, very insightful. So, guys, don't forget to SLCS. Don't forget to subscribe. Don't forget to like this video. Don't forget to comment. Please comment if you have anything you want to add, if you have anything you want to ask. Please comment, and don't forget to share. You might help somebody who needs to see this video, so share with your friends, share with your family. Thank you so very much, guys, and I'll catch you guys some other time. Bye.